Obstructive hypertrophic cardiomyopathy, Jerry, is a condition that's a genetic condition that causes structural changes in the heart. And we actually call it the great masquerader because patients and doctors often miss the condition itself. And you see it about 1 out of 200 to 1 out of 500 people that have this condition. But like I said, up to 80% of them can actually be undiagnosed or underdiagnosed. So it's really important to be plugged into the symptoms. And essentially what happens is that the heart is a pump. It's a muscle pump that pumps blood to our body and our organs all day long. When you have obstructive HCM, the heart gets stiff, so it doesn't fill normally with blood. And then the hallway that the blood uses to leave the heart actually gets thickened so that there's obstruction or, the blood's not able to get out of the heart. And then when you exercise, that can manifest as symptoms like, dizziness, lightheadedness, or feeling faint because the blood's not getting to your brain. You can have chest pain or shortness of breath or chest heaviness or palpitations because it's not getting to your heart and your lungs. So it can dramatically affect people's lives. In fact, some people aren't able to even do activities like walking the dog because of this condition. And that's why John and I are here today working with Bristol Myers Squibb to raise awareness about what the disease is and how it manifests and also some of the treatment options.
Yeah, so I'm a very active person. I always valued being active, played college tennis back in the day. And my symptoms started in my 50s, started getting dizzy when I was going for a walk with the dog, like Dr. Coley said, and those symptoms became worse over time. And those symptoms really interfered with the things that I valued most, and that was my ability to stay active. I saw a cardiologist about 3 years ago and was diagnosed with OHCM.
The hope here is that there are treatment options. Even though it's a chronic disease, you can't really make it go away. We can help you feel better. We can give you medications to reduce your risk of heart failure. We can also, stratify you for whether or not you might have arrhythmias. So, there's medications that are available to us like beta blockers. These are medicines that allow the blood more time to leave the heart. Certainly surgery is an option, but we reserve that for people who fail some of the medications. But there's also medicine that's in our toolbox that's called Camzyos or mavacamten. And that's a medication that decreases the force with which the heart squeezes so that it's less likely to kind of close in on itself and that hallway is less likely to collapse on itself, allowing the blood to kind of leave the heart more efficiently. And in the patients that I've treated with this medication, you've really seen them sort of turn around and feel so much better, start to live life again and go back to the activities that they enjoy. But of course, when you're giving a medicine that reduces the force with which the heart squeezes, you have to keep an eye on the heart. So it's important to monitor these patients with serial echocardiograms, which are ultrasounds of the heart, to make sure that the heart's not getting too weak. It's so important. Information and knowledge is power. So I say, if you have symptoms, of course, go talk to your doctor. If you don't have symptoms, read about obstructive hypertrophic cardiomyopathy at camzyos.com. Read about its symptoms, read about its treatment, really get informed. Because even though it's a genetic condition, it can happen spontaneously, which means you don't have to have a relative that has the condition in order to get it yourself. And, it's more common than you think, and it can affect people regardless of race, gender, ethnicity. So it's really important that you know about it.